Let's talk about how the healthcare industry in Nigeria is leveraging on technology to make things work in the country. If you listen to my intro, I would like for you to react to that.
Well, I would say that we are not doing much of that yet. But as we all probably know, the world of technology, artificial intelligence, automation is something that affects everything now. It spans into every sector and definitely is useful for the health sector also. Introduction, one of the things that limits it, of course, for a place like Nigeria and actually everywhere is the cost of implementation of some of these interventions or new innovations and technology. So it's useful through the span of healthcare, that is from diagnosis going down to treatment. It spans everything to administration, so every aspect of it is influenced now by AI and all of that.
So we're talking about digital health and how practitioners and entrepreneurs are leveraging this equipment, or how will I say it now, this tool rather, to improve access to medicines as well as all other healthcare services in Nigeria. So let's go to the hospices, right, which is actually called palliative care provision. Like I said earlier on, Nigeria is classified as a region with isolated palliative care provision. What does that mean, really?
It means that palliative care is a branch of medicine that is, should I say, fairly new. Some define it as the provision of end-of-life care or care for people who are critically ill. So in that sense, you are unable to provide a cure, but you're able to palliate. You're able to ensure that the person lives comfortably for whatever duration of life they have, whether they are terminal now or they're not terminal, but they are facing a chronic illness, debilitating illness that really limits their lives and their functionality. So if you have someone, for instance, with terminal cancer, nothing more can be done. You want to ensure that this person is comfortable, so whether they had pain, you want effective pain management. You want to ensure that they can live and die if need be, comfortably. And when they say that we have isolated palliative care, it means that it's not pervasive in our own environment yet. It's not something that you'll find commonly available. I happen to be an advisor to what's known as the Center for Palliative Care in Nigeria, which is based in Ibadan, which is one of the main organizations that has been pioneering palliative care in Nigeria. So if you take palliative care, for instance, in Nigeria, there are very few people with the expertise in that field right now. University College Hospital Ibadan has one of the first palliative care centers. I think it's the first palliative care center, which is actually an outpatient center where you can take such people to, just like you go to any clinic, but their specialty is palliative care. So you don't have that in many places. I think Ilorin also has a department like that, which Ibadan was also, collaborating with them to start, or collaborated with them to start. So you have it isolated like that. So I can talk of Ibadan, I can talk of Ilorin, so you won't find in most states, for instance, that palliative care is established properly in those places. So that's what they're talking about, that people cannot access that care, just like you would access, say, obstetric care in virtually every state in the country. Thank you.
Thank you so much. Do you think this is a lucrative area that business entrepreneurs in the healthcare sector could actually cash in on?
Well, it is actually, because again, when we start looking at the situation that we have, our social infrastructure that is disintegrating, and by that I mean that, in the past, what we used to have, it's not palliative care, but what we used to have that helped people, to live and die happily, in quote, was the fact that we had a strong social environment. So extended families will step in when somebody was very ill. You could be sure if the children were not available, the sister is available, the cousins are available, the nieces are available, the nephews are available. But now everybody, for instance, you find that all of those ones The younger generation are gone. There's no extended family that you can put people with, and people can say, look, I will take care of auntie, I will take care of uncle, he can stay with me, or he lives down the road from me. So all of those things are now more difficult because of migration to start with, so we've and also because of modernization, we are no longer as cohesive and as social as we used to be. So there are things that have made it now imperative. So many people abroad, for instance, now have elderly parents who need support, who need palliative care, and they now they're willing to pay. They're willing to pay for the services, but the real question now will be, how do you ensure that you get proper care from qualified people who should provide that kind of care for your loved ones? So it's lucrative, the business opportunity is there, but also we need to guard against quackery, as it were, of just anybody trying to do it just for the money's sake and not being able to provide the quality service that is required.
So let's quickly transit to the other topic, which is tied to this, the proposed budgetary allocation to Nigeria's healthcare sector in 2024. Are you impressed with what has been proposed so far?
Actually, tell you the truth, I've not really looked at what's been proposed. But the real issues, I think we need to get back to the rudiments of how we budget. Again, in fact, now I think we're in a very dire, critical situation. Because whatever we even propose, the questions that arise around our budgeting process, which is, how do we arrive at those figures? What do absolute figures really mean in terms of healthcare? So 2023, we had over 1 trillion naira budgeted. The questions to ask are, was that money even released at all? Whatever was released out of that money, when was it released? So you have situations where, for me, I would say that absolute amounts don't matter very much right now in Nigeria as to effective implementation of whatever we have budgeted. Okay, so, and by that I mean that if we had over 1 trillion naira budgeted for 2023, was that money released at all? First, in fact, maybe before we even say that, the question is, how was that figure arrived at? So you have budgetary situations where people are bribing to get their budgets passed, meaning that this thing is not based on any rationality. I just have to pay and then my budget is passed. We've heard about budget padding. That's also a problem. The question also arises as to when people say, well, we don't have the money, we need to cut it down, and they just cut out line items, without the rationale of defending. I knew of a situation years back, actually, where they told me a unit in the Ministry of Health had their whole budget cut out because they were trying to reduce the budget. It was just cut completely. And when they told me, I said, that's unbelievable. They said, yeah, that's exactly what happened. They just said, we need to reduce this, remove this, and they just cut it off. I said, but they're going to pay the staff in that unit, in that directorate. So you are paying the staff, therefore, to do nothing. That's what you have just said, by canceling all the money they need for functionality. So we go to those issues of, how do you arrive at the budget finally? We go to the issues of, was it released? Do we ever release the money? We go to the issue of, when we release it, when do we release it? So if you budgeted 1 trillion, for instance, and then you don't release the money until October, what then happens, because of our zero budgeting policy, is that all kinds of bogus activities will take place between October and December, because they will be trying to spend that money and arrive at zero. Okay, to say that their budget performance was very good, they will try to spend the money. But if I budgeted, I needed 1 trillion to do several activities from January to December, and you only gave me the money 3 months to the end, I didn't spend that money effectively. So I think we need to look at the effective implementation of budgets first, before we start being bothered or excited about whole figures.
How committed is Nigeria, government, and entrepreneurs in this field committed to health security?
Well, I think the word commitment is a very big word, and we can really question the commitment if we look at how things are falling apart. We'll question the commitment a lot. And we'll do so on the basis that when we saw genuine commitment, we saw performance. So when in 2014 we saw an Ebola outbreak, the world was shocked that Nigeria curtailed it in 93 days. When in 2020 we saw COVID-19 outbreak, relatively Nigeria's performance was quite good. Relatively, I mean, there were lots of issues, yes, but that's a global challenge. But again, relatively, we didn't fare badly. One major thing that everybody agrees on in those two instances was that the commitment was there. So in between, and now we will question that commitment because we see all of the problems that have bedeviled us seem to carry on. So how we deal with the money, we seems to carry on. In fact, if you go back because we're talking about budgets, if you go back to 2001, there was an African Union meeting and there was an agreement that in order to improve healthcare, we need to have what they call the Abuja Declaration of 15% of your budget should go to healthcare. We have not gotten anywhere near 10% since then till now. So again, that bedevils the question of commitment. But that doesn't mean that there are not fragments and sections and individuals in the system who are trying to get things to work. But again, that's why we talk about the health system, meaning that one part can't get it to work effectively. One person can't get it to work effectively. We must have a cohesion of vision, a cohesion of commitment, and we must all move together, towards the same goal. We must have the same view of healthcare. And so while some people, for instance, are looking at healthcare as infrastructure alone, they want to build a building and put a plaque with their name on it. They want to buy one expensive equipment. There are health experts who will tell you it is the system that you need to address. You need to look at the whole system and you need to address all of the parts of the system here and there. Of course, some with more weighted priority than others. And except you do that, you cannot get real impact in that sector. Okay, so I would say that I wouldn't say we're committed because definitely things are falling apart, and that speaks or challenges our commitment as a country towards healthcare or health security. Thank you.
Thank you so much. There's something you said about COVID-19, which is going to let me lead you to somewhere else I need us to talk about. Now, more than 80 companies are digitizing distribution of health products in Nigeria, Uganda, Kenya, and Ghana, right? This is following the 2019 COVID-19 pandemic. Now, these innovations offer a range of services such as digitizing distribution to providers and consumers and product data services. The trend also showed that innovators who digitize distribution to providers appear to be growing with a strong user retention rate estimated at 46%. As one of the major players in this field, what would be your advice to both government and entrepreneurs to leverage on this tool as regards the health sector in the country?
Well, I mean, at the end of the day, why you digitize or you come in with technology in any instance is ultimately for cost effectiveness, meaning that you want to achieve, best results at the best possible cost. So that should interest both the entrepreneur as well as the government, because one of the problems with government and healthcare is the cost of providing healthcare services to people. So you want to be sure that I can minimize that cost, and I can be very effective at what I do. So, for instance, there are those who use drones to deliver pharmaceuticals to difficult or hard to reach places. So your first problem is that those places are called hard to reach, meaning that your healthcare services probably don't get there as they should anyway. And if they were to get there, there are lots of difficulties and it probably costs a lot. So if there can be a solution like drones that delivers those things, then you're happy. Number one, it's going to get there. That's your first problem solved. Number two is at what cost? So the entrepreneur also has to look at it and say, look, I need to be able to market it to the government to say, I can reach the hard to reach place and I can reach it at a fraction of cost that you spend. So when I put my drone, it gets there quickly and on time, and it costs you just X amount of naira as against Y that was more that you used to spend. So that's the use of technology. That's how you do it. If you automate or you what do you call it? If you digitize, for instance, your records, then you also again are looking at effectiveness. If you go to many public hospitals, you go there today, you come back in 6 months, they start looking for the file. But if I'm able to put all of that and computerize and what have you, all it needs is the press of a button or two and the file comes up. The doctor is able to see it. Perhaps somebody has to carry a file from here to there. Again, the doctor sits on the computer, presses it, and the file comes up. Without anybody having to move around. Then you are looking for the person to carry the file. They said she went to eat, he went to buy something, and then you have to sit. So you eliminate all of these inefficiencies. So there's a lot of opportunities there, but we in healthcare, we must know healthcare is a social service also to a good extent. So most of the people will not be able to afford the costs. In fact, we tend to joke that most people are just one sickness away from poverty. So even your so-called rich man, if he has the wrong type of illness, can become very broke very quickly. So we have to, as if you're looking at it from the private side, you are thinking about, yes, I have innovations that can solve the problems, but you must also be mindful of the cost. Not just because government can't afford it, but also because the people can't afford it. And your best way to get in is to be able to say, look, this is the problem it solves, and it solves it at minimal cost.
Talking about cost, right? Let's take a look at funding trends as we speak. There are reports that shows that recent investment momentum has been strong in countries I mentioned earlier on, including Nigeria, Ghana, and Kenya, right? Even though funding is growing, it is highly concentrated. 72% of all reported funding in the last 12 months were focused in specific areas, not widespread. Now, such a high concentration of funding might lead to deficiencies in other aspects of the ecosystem. When we talk about the health ecosystem now, how can such gaps be plugged without heavy dependence on donors?
Well, so that takes us back to what you said earlier, which is that big word called commitment. The only way is that we have to be committed enough to our own health system. Over dependence on donors simply says that you're not committed enough to put your money where your mouth is. So you leave other people, or you beg other people, or you allow other people to have to come in and fund those things. While the real question is, can you really not afford it? Whether a lump sum, whether it's sums that come in tranches, are you truly unable to put down this cost? If we eliminate a lot of the waste we have in the system, are we not able to plug these gaps that you're talking about? So it takes us to that discussion about commitment. At the end of the day, there's that saying that also goes that where there's a will, there's a way. And that's commitment it's talking about. That once we are committed, we will find how to do it. We will find how to put the money on some of these areas, perhaps even the ones that are being donor funded. Perhaps we can even afford them by ourselves. So we would not know the accurate total answer to that until we have that commitment issue solved. Thank you.
Thank you so much. Let's talk about partnership between the private sector and government in Nigeria. How well is that going?
Well, it is coming up, and I'll say particularly also because of now the need or focus on health insurance. I think that has further integrated, the private sector with the public sector. in healthcare provision, because a lot of that now is being driven by healthcare providers. A lot of most people with health insurance would go to a private provider. In fact, you have the health management organizations, mostly private, if not all private. Then you deal with the hospitals. Most people who have insurance also will go to a private hospital, and that is making or bringing about a further emphasis. I call it further because everyone had known that the private sector contributes significantly to healthcare provision in Nigeria. Most people depend on the private sector. There are countries where there's no private sector healthcare, or very minimal private sector healthcare, including places like Canada, very minimal private sector care. So, but we know in Nigeria that's not the case. A lot of people who can, depend on the private sector. So with health insurance, because private sector, part of the challenge was you pay more, so most people couldn't afford it. But with health insurance, you can, affordability issue is being solved. Because once you have insurance, now you don't have to pay out of pocket when you go to the place there, and then they say, you pay 20,000, you have 20,000 on you, or you've been paying 1,000. You've been putting down 500 naira every month without going to the hospital. So that's how insurance works, and that makes it possible. Now, the next place it takes us to, or it should take us to, is to revisit the conversations about, for instance, things like data usage. So all the people that are being seen in the private sector, do we have access to the data? That I'm talking now, I'm not government, but I'm talking as if I was government. That does government have access to that data? So are we able to see everything that's going on in Nigeria? Because if 40%, 50% of people go to private providers, whatever they are being treated for, if it becomes obscured, from the health managers, the public health managers in the country, then their health or the management of public health is in that. It means that we don't know 50% of what is going on in our environment, but if there's central collection, there's, all of those things are on paper, but if it becomes more efficient and the private sector is supplying its data regularly, just like every public hospital does, to a central database and the ministry and all of that, then managing the healthcare becomes better. We're able to plan better because we can see the burden of disease. We see the burden, we see the patterns. We are able to detect disease also more readily because we're able to pick up the strange diseases, or sometimes what we call notifiable diseases. So there are diseases that once you see them, you notify because they are very important in terms of epidemics and things like that, so that you can act fast before they spread fast. Okay, so all of those things become better. So hopefully, as we have a greater integration now because of health insurance, all of those discussions that have always been there, for years and years and years, become pronounced, and then we'll have better efficiency in managing our health system as a whole, which would include both private and public sector. So even things like vaccinations, we will channel a lot more through the private hospitals, so that people who are afraid, who are not getting the vaccinations because they don't trust the health post in their place, can get it in a private hospital, and it's still provided by the government through the private facility, even if it means the government pays them a token for administering it to the public. So hopefully we're getting there. Thank you.
Getting there, fantastic. It's interesting that you mentioned vaccination. Just on the 24th of October, that's this month, the federal government launched the rollout of over 6 million doses of the HPV vaccine. Doctor, I'm sure you're aware of this. HPV is a virus that causes cervical cancer, and one of the things government said was that it was looking for partnership with states, local governments, and private sector as well. Your thoughts on this?
Well, so yes, it's that's the way to go, because you want an uptake. Many people, for instance, simply even on the basis of trust their private provider more. So if I know that I can get it through there, government should not try to channel just to the public sector. So it's good we have that kind of policy statement that we're seeking partnership with everyone, including the private sector, so that we recognize that people trust their private provider, and those things should be made available there. Even when you had the COVID-19 vaccines, the mere fact that it had to go through just a few centers that are government controlled in itself was an issue for many people. So imagine that we had a system that was very cohesive, and therefore even the COVID-19 vaccines were available in some of our private hospitals. You would have had a greater uptake of those vaccinations. So any of these things, including this HPV, we need to really be looking at, involving the private sector in these things, because they see a lot of the public patients. They attend to them and they are trusted.
What should be given priority when it comes to Nigeria's healthcare sector?
I think the health workforce, because nothing works without the people. So we are hemorrhaging, healthcare workers, and we need to stop that. And the only way to do that is to make sure that their environment is comfortable for them, to work in and to live in, so that they stop living in droves as they're doing. No matter what we put in place, if they're all gone, we are in trouble.